One of the big myths in the mental health industry is you have certain rights, like the right to privacy or the right to see and review your medical records and your psychiatric records. It's simply not true. You have few, if any, rights. The very first thing I did after experiencing the outrageous behavior of Joe Sepulveda, who's now the Chief of Psychiatry at Family Healthcare Centers in San Diego, in August of 2020, was to ban him and his subordinate, Darinka Aragon-Milagros, from access to my medical records. To do this, I wrote this note and posted it in the patient portal at FHCSD and made it clear that if either of them were to access these records, it would be an unacceptable invasion of my privacy. I even said that if they don't have the technology to ban specific individuals from my medical records, and they probably don't, then the personnel department should make it clear to them that they were no longer authorized to access these records. At the same time, I banned Sepulveda from making any inquiries about me in any government-controlled database about controlled substances. I did this because during our brief 10-minute online meeting, he told me I was under investigation by law enforcement. He was lying. I later learned from the director of mental health that he was talking about Cures, the system the state of California uses to track prescription drug use. I contacted this agency and they assured me there was no such investigation. Sepulveda had just made it up. I also renounced a controlled substance agreement I had signed with them. I did this because Darinka Aragon-Milagros, a just out of college psychiatrist working for Sepulveda, used this to entrap me into admitting occasional uses of cannabis and said that I had authorized them to conduct random urine tests whenever they wanted and that I had no choice in the matter. She was also lying. The agreement said nothing of the sort. When I finally found the agreement, I learned that it said no such thing. It says nothing about cannabis, and it says nothing about random drug testing or random urine testing. She just made that up. It was actually a perfectly reasonable agreement that basically said I would use these medications as prescribed, and I would not give them away to anyone else or sell them to anyone else. And I followed that agreement to the letter. There was no reason not to. In fact, this agreement was so reasonable that I didn't even really remember I had signed it with Dr. Ube, who had been my real psychiatrist, not Sepulveda, who fraudulently claimed to have been my psychiatrist, and fabricated at least a half dozen new psychiatric conditions about me, psychiatric disorders, even though I had never met this man outside of one single online meeting of less than 10 minutes. That's why I made one mistake in this document. When I said I had signed the agreement with a psychologist I had met only a few times before she quit the organization, Family Healthcare Centers of San Diego. The agreement had nothing to be concerned about, and I just simply didn't remember it. When I finally did get a copy of my psychiatric records from a third party, almost 3 years later, I was appalled, and I understood why they kept them secret and why they didn't release them. Both Darinka Aragon-Milagros and especially Joe Sepulveda had made absolutely bald-faced lies in the document, claiming I said things that I never said, and even putting them in quotes. Complete fabrications. There are far too many lies to go into here, so that will have to be the subject of another video. The lesson here is you ask for mental health at a government-funded community clinic, you have few if any rights, and you have zero privacy. Your psychiatric records are not under your control, and they could be used against you, even if they contain outrageous lies. They did for me. Thank you for your attention, and thank you for listening.